Hi, my name is Mary. I'm a research intern here in the HVCL laboratory.
Today in this video, I will be demonstrating arterialized venous sampling. When preparing to draw arterialized venous blood samples, we need to make sure we have all the right materials prepped. First, we need to prepare a saline flush. To do this, we need 0.9% sodium, a 20 gauge needle, and a syringe with a blunt plastic cannula. We're going to put the needle into the saline bottle, just like that. Invert and draw the saline back out to about 2 to 3 centimeters. Hold the plunger, re-invert, and twist. Now we are going to remove any air bubbles that we can see. Flick the side, you'll see some of the bubbles raise up. Now shake the syringe and slowly push the air bubble out. Once the air bubble is out, take the blunt plastic cannula, replace it on top, and then push all the air out of the cannula as well. It's important not to have any air in our saline flush, as this can be dangerous if we are pushing air into the catheter. Other materials needed are a sterile drop sheet, alcohol swabs, our prepared saline flush, a tegaderm, a tourniquet, a PRN adapter, tape, catheter, and a 22 gauge needle. Don't forget to have gloves on and a sharps discard bin nearby. When drawing arterialized venous blood samples, we want to catheterize a dorsal vein on the hand. The reason a dorsal hand vein is used is because there is a greater superficial circulation in this area. Because the veins in your hand are superficial and surrounded by lots of capillary beds, it is much easier to overperfuse them with oxygen. First, we need to increase blood volume to the hand. This is done by putting a tourniquet on the upper bicep, as shown here. Blood volume can also be increased by squeezing a ball or by manually pushing blood towards the hand. When looking for a good dorsal vein, we want one that is large and straight. This one here is a great example. We're going to try and avoid veins that are small or have large bends or curves, because when we're threading the catheter in, we need about a few inches of nice straight vein in order to get good flow. Now, not everyone's hand is this vascular, so if it's not, we're going to push some more blood down towards the hand and begin palpating to find alternative veins. This is done by pressing the fingers up against the skin, and we're looking for something that feels spongy and taut. This will indicate a vein. This is a retracting catheter and needle combo. The catheter is the blue Teflon part. When you insert the needle into the vein, you'll see a flash of blood at the tip, right here. Then you'll push the catheter over the needle and thread them through the vein. If the vein is straight and you have good technique, this will be a smooth process. Once you are fully in the vein, you will push the white button to auto-retract the needle. Then the unit will no longer be harmful and you will avoid poking yourself or the subject. If we imagine that this is the catheter, this portion over here is in the dorsal vein. If we overlay it on top of the vein, it would sit like this. Notice that the blue piece of the catheter allows us to access the vein for blood sampling. Notice that it's also an open port, so we must cap it in between sampling to protect sterility and prevent blood loss during experimentation. To cap it, we use a PRN adapter, which screws onto the top of the catheter as so. I'm going to screw the catheter into the PRN adapter. Now, notice that there is a flush attached to ensure patency. Once the catheter is in the vein, if we draw back on the plunger of the flush, we'll be able to check to see if we're actually in the vein by seeing some blood being drawn into the saline solution. If we see some blood, then we'll push the saline out, ensuring flow into the vein. Now, it would look like this on the hand. If we now remove the syringe, the rubber stopper of the PRN adapter keeps blood from leaking out. as you can see here. This allows us to do multiple blood draws without poking the individual multiple times. Definitely useful during experimentation. The last step is to heat the hand with a heating pad. This is most important to obtain an oxygen saturation representative of arterial blood. Finally, use the blood gas analyzer to confirm that oxygen saturation is 90% or greater. Once this threshold has been reached, then we have successfully achieved arterialized venous blood.